Esselstyn and Ornish, they're not all on the same page. And Jeff is a McDougal. He's like a Trumpster, but a McDougalster. Like anything that McDougal says, is fact. Now, I respect all of these doctors that are up there. Who's the last person?
I don't. Actually, I'm not sure who the last person is.
Okay. Is that Zach Bush? I can't even tell. But the other four are, they've been pioneers in their fields, and I have a lot of respect for them. I disagree with them on several issues here and there. But all in all, they're good doctors. But we can argue with them, and that's part of medicine. I mean, what Jeff doesn't understand is that there's nuance in science, and that science can be argued, but there's no end-all, be-all guru whose word is above and beyond anybody else's in any approach.
Yeah, I think that we might need to make a stronger statement than that. It's fair if that's your view, but I think Esselstyn and Ornish need to be very heavily criticized as promoters of dangerous pseudoscience.
Absolutely. I completely agree with that. Just making
are you what you're referring to is there kind of the idea that a plant-based diet is all you need in order to reverse heart disease?
Just the idea. Sorry, Avi, go ahead.
The idea that it has been demonstrated that a plant-based diet reverses heart disease. I think that's a false claim. It's not been shown that a plant-based diet reverses heart disease, and moreover, it has led a lot of patients to abandon medical therapy in favor of plant-based diets. There was a patient who recently was told, I'm not going to say who it was, but it was told by their plant-based lifestyle doctor to stop taking their nitrates for their angina and chew on cabbage instead to get the dietary nitrates. So things like that.
Yeah. When you and Danielle first kind of came out against them, I had to pause. I was like, well, I mean, plant-based diet is definitely good for heart disease. I think you and I were kind of talking about whether we should debate, but then we kind of end up on believing the same thing. And I kind of see the point. I'm starting to see this in my practice too. People thinking that plant-based diet is all you need. And if you do plant-based diet, you never need to see a doctor again. That's very dangerous.
And even if it weren't dangerous, it would still be pseudoscience. But
yeah.
And the other thing is just with the language used, they're coming out against them. I mean, it's fair; it's not a false claim or anything. But it is worth pointing out, like Avi was extraordinarily fair. He didn't come out guns blazing. He came out actually very politely saying, "I think you have some errors in your work. I think some of them are actually very important, and we ought to have a discussion of it." Right. So that was the tone that it started with people when they hear, came out against, they might get the impression that Avi just came out like friggin' going into battle. No, he was quite polite, quite reasonable. And it became very obvious that Esselstyn and Ornish are sophists who will not actually defend their views. The second that they know they're interacting with somebody who's going to be able to show serious problems, they're out there. And of course, those are debate offers that remain open. But yeah, I would like firmly label both those guys with pseudoscience, dangerous pseudoscience promotion. You want to continue?
Yeah. And many others.
But sorry, pause one more second. Really I also haven't talked to Garth a lot, so I don't really know your views, Garth. But if we're taking stances that are stronger than you take, let it just be known to the audience. Obviously, we don't speak for Garth here.
Yeah, I mean, I have a lot of respect for Esselstyn and Ornish. I Avi's not wrong that if you get into a debate on science, we could paint them into a corner on certain claims. There's no question. But I still have respect for what they do for the plant-based community, and they've helped a lot of patients. But the information, I agree with that if you lead someone to this belief that if they just eat plants, they never have to worry about disease again, that is a huge misinformation and definitely pseudoscience.
Okay. Some doctors out there, lifestyle medicine doctors and conventional medicine doctors.
Okay, so here's his big point here. It's like he's going to separate the vegan doctors into the vegan lifestyle medicine doctors and the vegan conventional medicine doctors. All right, we'll see what does he mean by that.
Conventional medicine can be very lucrative out outrageously priced prescriptions overpriced.
This is stupidest.
So it's already we're
It's just so funny.
already
I-
we're
I-
going to the show memes.
I haven't even watched it yet, but it's like this is where fucking Jeff would start, right? A conspiracy theory that conventional medicine doctors are shills, like, okay. And it's a weird.
So
I've
stupid.
never heard the separation before, but in fact, is there gonna even be a?
So far, he has not
contradiction
outlined a
between
criteria.
Yes.
Yeah, that's the thing. It's not. I don't see why. First of all, he hasn't really outlined the criteria. We'll see that, but he also doesn't give a reason why they're not exclusive. Why they are exclusive? Why
Yeah,
they're-
it's just
Anyway.
such a funny way to go in on a
Let's-
cartoon. Okay.
Watch the. Let's
Jeff
watch
Wilson.
the show memes.
Overpriced testing, and even unnecessary surgeries and procedures. They combine to make doctors and pharmaceutical companies very wealthy. Conventional medicine isn't that effective with chronic diseases. Treating symptoms does not do anything to resolve underlying health issues. So conventional medicine can treat symptoms, but rarely do they provide real solutions.
Very often provide real solutions.
Well-
There are many times.
This is
I mean,
also this is so vague. Like when he says he hasn't really, like you pointed out, but now he's going in and making statements about people practicing conventional medicine, but he hasn't really defined the term. Like how exactly does he even mean that when he says that?
Well, I think he thinks that lifestyle medicine doctors, they just work on lifestyle. So if you come in with hypertension, there'll be no medical treatment whatsoever. It'll all be diet. If you come in with diabetes, it'll all be diet, etc. And the people he's talking about, you know, if you go to Ornish or Esselstyn, who really don't practice, you know, I mean, Ornish has his clinics, but they're not really practicing doctors anymore, especially not McDougall. But they're not going to treat you with any of the conventional treatments. They're not going to do medicine. They're not going to do surgery. But if you go to the American College of Lifestyle Medicine, you will see thousands of doctors that do both, right? If you go to my clinic, I've got behavioral therapists, I've got 4 dietitians, we do an exercise class, I have an exercise physiologist. I talk to people every day, all day. I mean, Jeff has never sat across from a patient who weighs 350 pounds who has diabetes and heart disease and tried to make it better. And Jeff has no idea the difficulties involved in doing that. Jeff has done nothing for anybody except be a talking head. But every day I go to work, I wake up in the morning, and I face the real illnesses that are out there. And I face it using everything at my disposal, and everything at my disposal includes lifestyle medicine, and surgery. It's a comprehensive approach, and I think if anybody's doing anything exclusively, then they're missing out on a full breadth of treatment.
Right, that's exactly the point. I mean, the key here is that, number one, lifestyle medicine and conventional medicine are not mutually exclusive. They can both be indicated, and they should both be utilized as indicated.
So, do you think they are fairly clear terms then?
Not the way he's, I mean, we have
Because
our
the way
own-
Garth just talked about things,
Right.
Something like he just messed with, like talking about the things of like convention traditionally been used well, like surgery or I don't know,
So to be clear, so I agree that I understand the terms the way Garth is using them, but I don't. I think it's not clear the way Jeff has presented. I don't think Jeff has provided a clear definition of those terms. But
Well,
that's
American College of Lifestyle Medicine defines lifestyle medicine as treating as diet, exercise, movement, sleep, and stress.
okay. Jeff actually will provide in the video later on. He'll provide some sort of like attempt at a definition for lifestyle, but medicine. But he has not provided a definition for conventional.
right? Because he's basically just said conventional medicine is just stuff where they make money for
Yeah.
big pharma and like shill or whatever.
Right.
So yeah, I mean, it would be important to get a clear idea of what he's talking about in both cases. But like, let's just assume he's
Yeah.
saying something like what Garth is saying. Pull that from what so you said something like
The American College of Lifestyle Medicine.
Okay, that sounds like the kind of people who are gonna
Yeah.
have a reasonable definition of the term, right?
Yeah,
So,
you would think so, right?
yeah, it's like, I mean, you guys are doctors, correct me as the layperson here, but like, I mean, it sounds like if lifestyle medicine is, what are we talking about? Like sleep, eating, exercise. Or you're kind of talking about like lifestyle habits, and then conventional medicine. It's weird it wouldn't include that, but whatever. Conventional medicine refers more to maybe like we could be talking about anything from like a surgery to taking medication, stuff like this.
Right.
It's totally unclear that what the argument could possibly be that one of those exclusively is all that's needed to deal with the full set of medical issues that currently exist on the planet. Is that a fair statement?
Yeah.
Yeah.
And it's also that they are not always last line. Like they could be, you can have first line in terms of conventional therapy, and you can have lifestyle medicine that's also first line. Let's continue, because that's going to be a point on.
Lifestyle medicine, by contrast, is not led by a pharmaceutical approach. It's based on empowering the patient to lead a healthy lifestyle. Patients are encouraged to create.
Okay, not that this matters in terms of what the validity or soundness of the arguments that are being made, but there is an enormous amount of money in lifestyle medicine. There's Medicaid reimbursement to the tune of millions of dollars to lifestyle medicine programs that have gotten approval from it. There's also an enormous amount of supplements that are being sold. There's an enormous amount of diet books that are being sold. There's an enormous amount of revenue coming from videos. It's not true that there's not a lot of money in lifestyle medicine. There's quite a bit of money in both of these.
Which
one might outweigh the other, which is fine. I'm fine with both of those. So it's not an argument against either.
Yeah,
But
see,
it's a false point.
everyone should just, who's watching, should just note like what Avi said, right? He's basically saying, I can throw your argument back at you because this applies to lifestyle medicine too, but I'm not stupid enough to do that because it's a bad argument in the first place.
Right, exactly.
Create, safeguard their health with educated changes to their lifestyle. Now, that's not to say lifestyle medicine doctors don't sometimes prescribe drugs or use some of the tools of conventional medicine, but that's sort of a last resort.
Okay, so that shouldn't be done always as a last resort. In fact, many oftentimes that someone has a condition, they should have both medication and lifestyle interventions as first one, right? So that approach is actually not the correct approach for many reasons.
Yeah, we need some kind of argument that lifestyle is always, it's always going to be best for patients for lifestyle medicine to be the exclusive first-line treatment.
Right.
What's the argument for that?
Yeah.
Community, there are both kinds of doctors. You have lifestyle medicine doctors and you have conventional medicine doctors, but here's the thing. The advice you get from plant-based conventional medicine doctors can be very different from what you'll get from plant-based lifestyle medicine doctors. And therein lies the problem, as I see it. There are so-called vegan conventional medicine doctors prominent on social media who are posing as lifestyle medicine doctors.
Posing as lifestyle medicine doctors.
Fakes, in other
Right,
words.
see, it's weird because the video, ostensibly is about you two and Danielle. So, presumably he's talking about you guys, but do any of you even claim to be lifestyle medicine doctors? Don't you all take a mixed bag approach?
Yeah, so to answer the question, to answer the question now, I would describe myself as someone who advocates both lifestyle medicine and conventional medicine as indicated. But actually, I've never described or marketed myself as a lifestyle medicine doctor. So to say that I've been posing as a lifestyle medicine doctor, I think that's funny. I don't recall anywhere that I've said I was a lifestyle medicine doctor. So to make the claim that I'm a fake somehow presumably that would require him to show me, or shows the audience, some example of me saying that I'm something that I'm not, or any of us saying that we are something that we're not.
I mean, he has plausible deniability. I didn't talk about you by name, but his the video presumably is supposed to be about you guys. The claim he just made, as far as I know, doesn't apply to any of you. So it's kind of weird. It's like a well poisoning based on something that's not actually true of any of you.
Yeah, I mean, I do lifestyle medicine. I mean, it's a big part of my clinic. And I've been a speaker at the American College of Lifestyle Medicine. I've never seen Jeff at the American College of Lifestyle Medicine. nor have I seen any of the people that, well, I take that back, I've seen more interesting. But yeah, I mean, he's, again, you can be both.
And just to be clear for everyone, I mean, it might be obvious, but Garth, you are in fact saying that you are someone who takes the both approach.
Oh, without a doubt,
Yeah, so Jeff actually, it's weird because he's doing a lot of sketchy stuff here. He's making this separation, and whether his definitions actually allow the separation to make any sense or whatever, who knows. But if we kind of assume he's using definitions like you, it's weird because it's like lifestyle medicine gets to be it just borrows from conventional when it's funny. It's like actually, you know what? I'm not even going down that pathway. It's fine. What he needs to do is the core of this is he has to give some kind of argument for why lifestyle medicine exclusively as a first line treatment is what will maximize the well-being of patients. Right? I was going to make another point, but confused me when I tried to make it. So that's the core, right? And I highly doubt we're going to see that argument from it.
Yeah. We're going to continue going. Isaac, just can you enable screen sharing for when we get to the part where we have to go through studies?
You want me to go to Discord right now?
No, not right now. I'm talking about the Zoom meeting. I'm going to share the screen.
No, there's no way I can
Oh, okay.
do that.
Oh, you can go through it in Discord then. That's fine. All right, never mind. Okay.
Yeah, it would show up in your camera box.
Yeah. All right.
Yeah.
Oh, I see what you're saying. All right, cool.
In a minute, but my advice boils down to this. Take guidance and opinions from conventional medicine doctors, even when they're vegan, with a grain of salt. Conventional medicine doctors may not understand lifestyle medicine, they understand pills and procedures, but they may not know about or provide you with all your options. Dr. McDougall has pointed this out for decades.
Can't you say that in reverse?
Yeah, you could say it in reverse. I would say take everyone's advice with a grain of salt and don't blindly trust anyone. And then their ideas stand on the data.
It's funny when you say it like that, because you're basically like, question everybody, and then you realize it's actually kind of implicit in what Jeff's saying when he's saying just question this one side. But he's actually saying, well, don't question the other side.
Right. It's like, yeah. No, I mean, I would just say the same for the other, for anyone. Okay.
I mean, I think that's the stupidest comment. What an idiot.
It's
to say that you should question a lifestyle conventional medicine doctor. Now you're talking about someone who has everything at their fingertips to treat you. They've got the lifestyle and they've got medicine. You don't need it in. You got surgery. That's exactly the person you should be trusting. You shouldn't trust McDougall, who's got absolutely nothing. If you're a hammer, all the world's a nail. So all McDougall has at his disposal is his lifestyle program, and his very specific lifestyle program, not any kind of variance to his exact program. We, on the other hand, have multiple things that I can offer someone to lose weight, or that Danielle can offer someone for their heart disease. So it's just so stupid. I don't know. It's beyond that.
Well, it's also weird because it's like he's saying lifestyle good. Sorry, this is the point I was trying to make a minute ago. I keep wanting to make it, even though it's not totally clear in my head. It's like maybe someone can help me out here. It's like he wants to say lifestyle good, conventional bad, but then a lifestyle doctor is allowed to borrow from conventional medicine just to whatever degree is needed to optimize treatment. But then a conventional medicine doctor doing the same, it's like there's some kind of problem there. Like, are there a fake, or does they just become a lifestyle? It's like he's trying to take the middle category of people who do both, which is the preschool people, and call them lifestyle doctors. That sounds like the middle category.
He's clearly not a logical thinker.
No, I mean, there's no fucking way this guy ever took imagine Jeff in a formal logic course.
I watch this stuff and this guy has got no experience whatsoever. He's never treated a patient. He has no idea what he's talking about. I've never seen him at a single scientific conference. And all he does is go on Google and pick whatever study fits his narrative. And I don't know, it's ridiculous. I don't know. Maybe we're giving this guy too much time. Anyway, go on.
Sorry.
Our colleagues continue to do this. Can you imagine me as a doctor, you coming to me with heart disease, and say you had clogged arteries, and say I believe bypass surgery was good for you, and say or at least say it was good for you, and say I didn't know about it? maybe I didn't like the people who were doing bypass surgery, and I just passed it over for those reasons. Can you imagine what would happen if that surgery was of value to you and I didn't offer it to you? I'd be at least considered a terrible doctor if my license would be revoked. What happens when a patient comes to a doctor with type 2 diabetes, Dr. Kaufman told you this morning was due to the rich American diet, comes to you with clogged arteries, heart disease, and a highly effective, scientifically established approach to the problem is ignored or discounted and not given to you, which is diet and lifestyle change. And it happens every day in 99.99% of the cases, and my colleagues get away with it, and it needs to be stopped.
Here,
Okay, so like both of those things, but the arguments can be made both ways. So yes, you should not hide lifestyle interventions from your patients. You should also not hide medicine from your patients. Or surgical
Dougal
interventions
just said,
from your patients.
I mean, Dougal just proved our point there, right? He said, you know, wouldn't it be terrible if I didn't offer you the bypass surgery?
Yeah.
It's funny how many of these points run the other way.
is the definition of lifestyle medicine. You can freeze this frame if you want and read it. This is from the American College of Lifestyle Medicine, which was started a dozen or so years ago. In 2011, they started putting on conferences in College of Lifestyle
We should
Medicine,
actually
which
go
would
back
start
for
and freeze this frame.
Alright, so lifestyle medicine is the use of evidence-based lifestyle therapeutic intervention, including a whole food, plant-predominant eating pattern, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connection as a primary modality delivered by clinicians trained and certified in the specialty to prevent, treat, and often reverse chronic disease. Okay, I don't know what exactly they mean by primary modality, but I don't see how this is incompatible with conventional medicine. You can use, if what you mean by lifestyle medicine is using evidence-based lifestyle therapeutic interventions, whole food predominant eating patterns, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections, you can do that in conjunction with indicated medical therapy, with indicated surgical therapy as well.
Yeah, it's there's a little weirdness here because when they say primary modality is an interesting word to use there, but there's two things that kind of seem relevant here. First of all, you can have two things that are primary, right? If you say you have like, you know, a set of sets, and each element in that set has each element in that set is a set with two elements, right? The primary element in the larger set has two elements in it, right? So it's like you could have two primary things, right? You could have a primary. You could have so say that one of those subsets in the larger set is lifestyle medicine and conventional medicine. That set of two elements could be the primary element in the larger set, right? So it's the point there is just it's not clear why lifestyle medicine as a primary modality would exclude conventional medicine as a primary modality, because primacy doesn't imply exclusivity, right? You have two things that are primary, right? This set theory thing is just an example, right? The primary element in the set can be a set of two items. And then the other thing to point out is, aren't there cases actually where lifestyle medicine should not be a primary modality? Like cases where there's just some conventional treatment that should be sort of like first line?
Well, yeah, I mean, there's clearly examples of that. Clearest example is in emergencies. Someone is having an acute ST segment elevation, you're going to put a stent in them, unless you're not going. What you're not going to do is you're not going to just prescribe lifestyle intervention when they're having a stenting, or when they're having an end stenting.
Right. So like I assume you would agree with both those points. So primary is not being exclusive, right? You can have your primary.
No, like when I see a patient for weight loss, my primary modality, I tell them all the time, is lifestyle changes. Now, I might do a surgery to help them I always call the surgery a tool, or I might prescribe a medication to help them make the lifestyle change. The lifestyle change is my primary modality, but I use other modalities with it.
Well, I guess I wanted to point out that primary doesn't mean exclusive, right? You can have two things that are both primary. right? Like that's kind of what I was pointing out with set
They
theory.
may be using a different. They may not be using a set theory definition of primary.
Well, I'm just talking.
Yeah.
I don't know what
Yeah.
else primary would.
Yeah.
You don't have to talk about in terms of set theories. Why does primary have to be exclusive? Why is there only
Right,
one
right.
primary thing? Right.
We have-
Because it just assumes that things don't come in sets, right? It's like the primary modality could be the combination of these two things. Doesn't that make sense?
No, I understand that. I understand. Depends on how they're using the word primary.
And then the other thing is that it's not always right to have it as the primary modality, which might be actually a criticism of lifestyle
Right.
medicine.
if you want. And this is from the American College of Lifestyle Medicine, which was started a dozen or so years ago. In 2011, they started putting on conferences for the public. Their conferences were practically identical to the events my wife and I started putting on 10 years earlier than that, with all of the same speakers giving the same talks and so on. So I've been involved in helping promote lifestyle medicine for decades, long before it became hip. Lifestyle medicine doctors often expose the weaknesses and uselessness of many conventional medicine treatments. It's important to do that so
Isn't
people-
that just something else that can be said the other way around also?
Yeah, that's completely not true. There's not. He doesn't go to these American College of Lifestyle Medicine meetings. No one's in there saying conventional medicine is false and it's bad and we shouldn't do it. That is absolutely false. Most of the people there are endocrinologists and other kind of medical doctors that believe very solidly in medicine, believe in vaccines and all that kind of stuff. They just believe lifestyle is another treatment course to add to the patient's care.
People realize most standard medical approaches are not going to save them, and so that they had better look at diet and lifestyle, which can. Again, Dr. McDougall has been discussing this for decades, exposing the major problems of conventional medicine.
This is a typical patient. This is somebody who has high blood pressure, type 2 diabetes, high cholesterol, high triglycerides, gout, an element of kidney failure, overweight, mildly arthritic, constipated, and depressed, and this is not an exaggeration. And they ask for help. And the doctor sincerely tries to help them, but unfortunately they have a bag full of useless, harmful tools, by and large. Please, let me know there are exceptions. If I get in an auto accident, don't meet me in the emergency room with a baked potato and a carrot. Okay? But I'm talking to you about the chronic diseases that are due to diet and lifestyle. We have nothing to offer you but useless, harmful drugs that are very expensive.
Okay, well, that's not true. They're not used. We have plenty to offer them to manage these conditions, and we also have lifestyle to offer them to manage the conditions, and they treat underlying causes as well. I mean, it's not to say that our medications for those diseases are useless. It's just completely not true. It's just a false claim.
That's ridiculous. He's going to say that insulin is useless for diabetes, or is he going to say that a statin is useless for heart disease? And we got so much data on this. It's ridiculous to even bring it up.
That will corrupt you. That will take your home, your family earnings away from you. A well-treated patient is the patient that you see on your right. What's the difference? What do you see different? Nothing. They're still fat and sick. They're just carrying around a bag full of drugs and a thinner wallet. That's all.
Like, imagine if I gave an anecdote and took someone 2 years later with a bag of lettuce, and I said, like, hey, therefore, a plant-based diet doesn't work, because here's this anecdote where, someone's still, sick. I mean, this is the level we're operating.
Does he actually provide any data in this entire
No.
presentation?
Oh, I don't know about this presentation, but McDougall's very low on data. He doesn't do any prospective studies. You would think with all the stuff that they have that there would be some good prospective studies. He had one on rheumatoid arthritis that was mediocre, but really not good, prospective studies. So I have, in my clinic in Houston, I had a weight management clinic, which was had a lifestyle component, had a surgical component. Obviously, I'm very interested in the lifestyle. At one point, my partner, who was my father, said, "Okay, well, let's do a competition. I don't do any lifestyle with my patients, and I bet you my patients do just as well as yours. If I'm going to do surgery on them, you do your plant-based diets on them." So we did a prospective study. It wasn't very large, and But in the end, at a year, his patients were doing better than my plant-based diet patients. Not the ones that had surgery, but my plant-based diet versus his surgery patients. And so he said to me, he made the statement, my father did, he said, looking at this data that we're looking at right here, this plant-based program that you're running through the clinic is malpractice. And I was like, how can you call it malpractice? It's lifestyle medicine. Because you're telling these people that the lifestyle medicine is just as good or better than the surgery I'm providing them. But look at what the data shows. It shows that the surgery with no lifestyle whatsoever is better than that. Well, if you look at this Cleveland Clinic, there's been several lifestyle medicine, the Swedish obesity study, where they took lifestyle medicine and they tested them against pure surgery with no lifestyle medicine at all. And the pure surgery group always beats the lifestyle medicine group. And so that's real data. What he's providing is anecdote. If you look at the real data, I don't believe this, but if you look at the real data, you can make the comment my father makes, is that saying that someone should do lifestyle medicine is actually malpractice.
To be clear, to say someone should do lifestyle medicine to the exclusion
To the
of
exclusion.
indicated surgery. Yeah,
To the
yeah,
exclusion.
I would agree.
Now,
That is
obviously,
malpractice.
what I do is I come to just really combine the two together.
Right.
Again,
of
my
course.
primary component is to teach people lifestyle. I use surgery and medicine to help them reach that lifestyle.
But Garth, why would you do that? Why not just dogmatically cling to lifestyle medicine ideology? Wouldn't that be more sensible?
It would be sensible if that's what the data shows me, but I always go by the data.
No
And I
difference.
do not go by, the worst thing to me is this, a anecdote. Because what happens in the anecdote, people, they're always like, I always get, if you go through my Instagram, you'll see some pictures of patients, and I've got surgery patients and lifestyle patients that I put on there. But I always get hesitant putting them on because it's such an anecdote. And taking one patient's anecdote is such a dangerous thing. And I'll tell you one example is I just did a live last week with one of my patients who I had put all over my Instagram because he was such a huge success, and we did a triathlon together. He was 500 pounds. Then we got down to 220 pounds, did an Ironman, and that was my pictures all over my Instagram and my social media. 2 years later, he's gained 50 pounds back. And so if I was 250 pounds, but that's not the fact. And it's a little bit of a lie to use that because these anecdotes, you're looking at this cross section. You're looking at it one point in time. Let me see this guy 10 years from now after we do that.
Yeah, and let us see a bunch of other people in similar conditions. And
Yeah,
what the kind
exactly.
of trend. Yeah, exactly. I just can't help but like picture someone like Jeff Nelson like trying to take just like an intro logic course or like an intro stats course and just like having
But
utterly
even
no idea.
what I would really like, people like this, what I really like to do, because they've got no idea, they don't, and look, I mean, don't want to ever put down lifestyle because I believe in it. Look at Jeff, he looks freaking good, right? I mean, he practices what he preaches, he looks great for his age. It is good for you, that's why I practice it myself. But what I want Jeff to do is to come into my office and me send him into a room with my typical patients coming down from the Appalachian Mountains. I mean, the typical patient coming to McDougall is worried well or sick, but believing in the treatment that they're about to receive and has the money and finances to go to California and get that treatment. That's not the patients I see. So I want him to go and see my 500-pound patient, treat him as best he can, and then see that patient back every month and see just how well his lifestyle medicine is.
That's probably malpractice.
But what I want Jeff to understand, what I want him to feel is the difficulty in treating patients in a day-to-day basis in a medical practice. It's not what he thinks. It's not people at a retreat in California. That's not your typical patient that you're treating. And it's not people with a lot of money. It's not people with a lot of knowledge. And it's not people that are going to be highly compliant to these things that you're recommending to them. And it's a very frustrating job to try to treat patients, and I don't think that he understands that even in slightest bit.
Yeah, it seems like a kind of theme of your criticisms here are that he is just shockingly out of touch with the reality of what it's like to be a doctor. Which is not surprising given that he's not a doctor, but
And he's also shockingly out of touch with with science. Like he never goes to a scientific meeting.
Right.
I think I haven't seen this, but I think at the party criticizes me, he brings up an article where I was at the freaking meeting where we tore the article apart. But he wasn't there
We'll
for
get to
that.
that, yeah.
He just Googled it. So that's the thing. He's not a scientist.
Well, and I know we want to continue with the video, but this is the whole thing also about a live conversation, right? Because if you do these video responses, Jeff can take some time to Google things and give some air of kind of knowing what he's talking about, even if people who are kind of in the know can run a debunk on him. But in a live conversation, I'm sure it would come out that he doesn't know a lot of the basic terminology in the areas he's talking about. He just doesn't understand basic kind of concepts in a lot of these areas. But that would all come out in a live conversation. Avi would push down some road, and Jeff wouldn't even know some of the terms he's using, right? So you can understand why he would avoid a situation like that.
Don't put you in a situation where you have to worry about whether you're going to join Kaiser or PPO, or what kind of health insurance you're going to get, or what kind of doctor you're going to choose, or what kind of brand of drug you're going to take, or get out of the business. And you can get out of the business, but you can only do it one way safely, and that's to be healthy. Sick people take drugs, healthy people don't. Sick people wait in the doctor's office once a month for refills, healthy people don't. And you can become healthy. I don't care how bad a shape you're in now, you can become healthier than you ever imagined. And almost everyone in this audience can get off all your drugs and avoid the majority of diseases by doing things that cost nothing, that you know everything about already after attending this weekend.
Those are
Get out of
such.
it.
That's
This
like
is
something.
so cringy. So actually disgusting. And because people who don't really understand the nature of the disease they have will hear this and be like, yeah, it's almost like you're a failure if you are taking your medications
Right.
because you haven't succeeded in doing the lifestyle to the point where you need to get off medications. No, there are plenty of conditions where you're very likely not going to get off your medications, and you're going to be healthy with your medications. And you should be taking them, and you should be engaging in the lifestyle medication. And guess what? You're also not a failure if you don't get off your medications. There are some conditions where you may be able to get off them. There are plenty of conditions where you're not indicated to get off of them, even with the lifestyle interventions. And that's okay. You can be healthy on medications with the right lifestyle as well. I want to be clear, this is the wrong message. It's actually, it sounds good. I know, at first glance, this sounds like a great message. I want to be as clear as I can. This is a disgusting message. Horrific.
Right, and it's weird also because in a way, earlier on, for example, he said there's situations where you need conventional I don't know if he said conventional or whatever, but he's you get in a car accident, you're gonna need surgery or something. He said something like that, right? But it's I'm not even sure. Sorry, I'm fucking in outer space. Whatever. Continue. Oh yeah, no, I remember what I was gonna say. Sorry. Yeah, he says that, right? But it's the picture. So he kind of can save his ass by whenever you bring up an instance where you obviously need to mention this. He's like, well, I acknowledge there's history. He can say that given what he said here, but it's very clear that the overall thrust of what he's saying is basically you're kind of like a dupe if you're going with conventional medicine. You've failed to be healthy with the means that work. You've been fooled by these shill doctors. So it's okay, you might cover your ass by saying if you get in a car accident, you might need surgery or whatever. But it's the thrust of what he's saying is fucked. And if that advice were taken by a lot of people, we have reason to think a lot of their health would decline. And additionally, no argument is given for why it would maximize their health to do this.
Yeah, I mean, I look at it's like fat shaming. I can take my patients and say, "You're fat, and it's all your fault." You haven't walked a mile in these people's feet, shoes. There's a million. They have a long family history of obesity. Their socioeconomic situation, their traumatic past childhood. Most of these patients have been dieting since they were tiny. If you do functional MRIs of their brains, it's a totally different looking brain than the brain of a normal weight person. And we know that they've got decreased dopamine receptors, and they have different responses to food cues than other people do. And so it's really a very complex thing, obesity, and it just isn't treated by saying, hey, you're fat and you can get better. That never works. It doesn't work. I don't care. I'll take on I'll take on anybody out there and offer a $25,000 prize if you can do better at 5 years weight loss than what I can.
Business. Thank you very much.
Now let's look at a vegan doctor who is not a lifestyle medicine doctor, but a conventional
Okay, so just
medicine.
pause for a second. So it's because when we cut in and give commentary, it's easy to forget like what's happened. But like, so far he's opened up. He's implied that conventional medicine is like an attempt to get all your money by doctors who are working for big pharma or some fucking crazy shit like that. Played a clip of McDougal ranting like a fucking unhinged lunatic, and now he's set the scene. So now we're going in for some. It's great, amazing start to the video.
And also, the further claim was made, he's saying, let's look at a doctor who is not a lifestyle medicine doctor. So now it's not implicit anymore. It's been claimed that the doctor he's going to mention is not a lifestyle medicine doctor. So he is making a claim with respect to that doctor that it's exclusive. They are exclusively conventional.
The doctor, cardiologist Dr. Danielle Belardo. Dr. Belardo is one of the vegan critics.
Pause. He could have a weasel pathway of saying he's just saying she's not exclusively a lifestyle medicine doctor.
She's saying she okay, but he didn't. I mean, he's saying
He doesn't
she
say
is not a
Yeah.
She's saying he said she is not a lifestyle medicine doctor. Now, if he wants to say by not a lifestyle medicine doctor, I mean not an exclusively lifestyle medicine doctor, I mean you could change that, but I don't know why we would assume the exclusive part.
I'm just saying there's a weasel pathway there, because if we're about to go, well, like, look, I mean, Danielle clearly is, like, approving of some amount of lifestyle medicine, right? He could just back his claim up to, well, I just meant she's not doing exclusively lifestyle medicine. But, let's...
All right, if he wants to say that, it's fine. It's just an exclusively lifestyle medicine. Thank you. Anyway.
Right.
Critics of actual lifestyle doctors Cornish and Esselstyn. Here, Dr. Belardo describes in a recent podcast her response when a cardiology patient came to her and asked for her help to use lifestyle medicine in his situation.
Told him absolutely not. Not only do you need to be on your dual antiplatelet therapy, you need to be on a high intensity statin, you need to be on a PCSK9 inhibitor, you also need coronary artery bypass surgery.
So basically, this is what Dr. McDougal was talking about. The patient on the right in Dr. McDougal's slide, the one holding the bag of drugs but not doing much better, this is a patient following conventional medicine. It's the opposite of lifestyle medicine, but it's very lucrative for the doctor and the
This is
medical
really
system.
disgusting.
Yeah.
Now contrast Dr. Belardo's conventional medicine approach to someone with advanced heart disease who used lifestyle medicine. Here's a 44-year-old man who had a heart attack.
Yeah.
Here we go.
Yep. The quantitative, the angiography, the angiography slide, the ultimate cherry pick on it, that's played around by Esselstyn.
And also, why is he just comparing one Danielle patient to this one person? That's one point. And then the other point is, why does he know that the patient Danielle's talking about wasn't someone who actually should be on said medicine? Like, he seems to, the only thing I can infer here is it's like he thinks that it's like universally quantified, right? That you should always, that like there just isn't a situation where you would make the kind of prescriptions that Danielle just made there, right? Because how else, unless it was a universally quantified statement, would he be able to, without knowing who the statement applies to, say that the statement is wrong, right? You follow me on that one?
And I'm also, the further irony is, I'm also pretty sure, I rewatched the video, but I'm also pretty sure this is a patient that she advised to go on these conventional therapies, refused them, went to do a reverse plant-based diet, and then had a massive heart attack. Yeah.
Isn't it crazy though? He's without actually knowing. Like this again is probably. I mean, it's probably this. What I'm about to point out probably seems even more obvious to you guys as doctors, but like this just seems like such an example of Jeff like being in over his head, having no clue what he's talking about, right? Like he doesn't know who the patient is. He doesn't know their story. He hasn't seen their like medical records or the kind of thing that any competent doctor would presumably want to say before making like specific prescriptions for them, as opposed to just like general statements.
Oh no, of course, it's absolutely
it's just insane.
Yeah, no,
It's like
crazy.
without looking at any kind of medical records, without having any kind of medical training, just a sudden it's like he's just saying, well, Danielle's statement that this guy should be whatever on his PSK9 inhibitor, whatever the fuck she said, right? Yeah, it's like he knows that's wrong without knowing who the patient is or what their situation is, right? How's that possible unless he just thinks in all situations, right? It seems like he just thinks it's always wrong to be prescribing these things. It's like, wait, but what about the cases where like this is going to seriously benefit someone? And yeah, I have Debbie has her data, but right.
2007, he had an 80% blockage of the circumflex artery. He had other blockages as well, and his conventional medicine cardiologist had told him he needed conventional medicine. He told him probably something just like this.
I told him absolutely not. Not only do you need to be on your dual antiplatelet therapy, you need to be on a high intensity statin, you need to be on a PCSK9 inhibitor, you also need coronary artery bypass.
Okay, pause. Because I feel like I have a sense of like how this sounds to a layperson, okay? Because I think you guys are hearing these all as technical terms, knowing exactly what it refers to, right? But to a layperson, this sounds like a bunch of scary medical shit, right? It sounds like I would be fucking horrified if someone told me, they're telling me this. Someone was saying, you need coronary bypass surgery, this and that, and then there's some other person there saying, look, no, the doctor prescribing these kind of things, like these things. They're actually just like crazy, and like you're gonna go through all this medical horror when really like you could just be like, right? Like that's the kind of thing that like if true, it would be so worth knowing. But it's so I don't know if I can capture it very good. It's like so disgusting to paint that as if it's true because I'm picturing these people who don't know anything about medicine, right? You hear these scary words, they're already freaked out. It would already be like a bit of a like a jump for them to do what they need to for their health. Surgeries or medications or whatever, and then you have fucking Jeff Nelson over here scaring them away from those treatments with the lie that this is going to do nothing for you and you should just be eating carrots.
Yeah.
Like that's fucked. That's actually disgusting, right? And I guess why it's disgusting is like it's like preying on these poor people who just don't know any better and are making bad medical decisions. But like B, it's advice that if taken is sure to produce bad results, if not in an individual person, on aggregate, right? If everyone who's currently being given these prescriptions by doctors takes exclusively lifestyle medicine solution, right? It's like that. There's going to be people who get really fucked by doing that.
Yeah.
Right.
Oh, I mean, the guy's a lunatic, obviously.
That's right. So he was told he needed a lot of drugs and a bypass, and forget about lifestyle. You're too
Do you
sick.
know that he doesn't?
Yeah, and exactly. Like,
Have you
how do
seen
you
his
know?
medical records? Like, can I ask you something? As a doctor, I would assume it would be malpractice to make statements about what a specific, tell me if I'm wrong here, what a specific patient should be doing, and not statements that are general, like that kind of apply to everyone, like health, right? Statements about specific, like, medical pathways, like what kind of surgeries they should take without looking at their medical records. Surely that would be malpractice, right?
No, it would be crazy.
So it's like Jeff's. The only reason it's not malpractice is because he's not a fucking doctor
Not
in
a
the first
doctor.
place.
Yeah.
If he were, it would be just absolute malpractice what he's doing here.
But this page heard about Dr. Esselstyn, and he purchased Dr. Esselstyn's book. He skipped the bypass, and all by himself, without having any cardiologist or doctor assisting him, he changed his diet and reversed his heart disease. He went from 80% blockage to no blockage.
Okay, two things I'll point out. Number one, it's an anecdote. Who cares? Number two, that's a different angle view of the artery. So, I want to point out that you can make something as small as that 80% blockage, that 20% open lumen of the vessel. You can make that look like a fully patent and open vessel with zero blockage just by rotating the angle of the view that you're looking at that vessel from. That's why when you're doing these comparisons, you really need to make sure that you're looking at the vessel from the same angle. A small difference in the angle that you're looking at can actually make a difference between a 0% blockage and an 80% blockage, and vice versa.
Yeah, like
So this, yeah. Yeah, like this. So number one, it wouldn't matter even if true, because we don't infer causality from cherry-picked angiograms. But even within the lowest level of evidence that he's bringing, the anecdote, even within that the terrible quality of evidence, even that fails. Because you can actually even infer that the blockage changed based on these two pictures.
And I don't, if you look at Ornish's data and all that stuff, no one goes from 80% to 0.
Yeah.
I mean, they go from 80% to 79.5%, you know?
Yeah.
I mean, that kind of a change right there is not true. That's not.
It's weird because, like, the impression you would get watching this Jeff video is, like, put down, you know, the conventional medication that your doctor has prescribed to you, right? You can just count on getting, you know, like an 80% reversal of artery blockage by just eating plants. Like that's the claim, right? That's what's underlying all these shots. But it's like, will we actually be, you know, presented any data, anything like that?
And let me take the devil's advocate view a little bit, because there are doctors out there that will totally jump straight to do surgery when you don't need surgery, or get a stent when you don't need a stent. I mean, we know that angioplasty works well in a very acute situation, but not in a chronic situation. And so there are situations where I think people are getting stents and they don't need them, et cetera, et cetera. But aren't we saying here that who better to go and see? Like, you don't want to go and see one person, one extreme. You don't want to go to the doctor who's not going to tell you anything except get a stent. But you also don't want to go to the doctor who says don't do anything except eat a carrot. So couldn't there be anyone better to go and see than Dr. Gallardo, who's going to sit down and go over all the different benefits and risks on both sides and give you a lifestyle program to go either exclusively or hand in hand with a treatment? And that's where Jeff's saying go with one extreme and avoid this middle ground person who's going to tell you everything. That really is real here, because you got someone who's going to do lifestyle and conventional, and that's what everybody should be doing.
So it sounded like that turned back into a criticism of Jeff, but the devil's advocacy was just to say that there are some doctors who actually are, just like there's doctors who will stick exclusively to lifestyle or prescribe that first line when there should be something else first line. There's the reverse, and you guys would readily grant that, obviously, because you're not ideologues.
Of course.
0. These are slides he sent to Dr. Esselstyn. So he reversed his heart disease with a book you can buy used on Amazon for $2. I've been talking about cardiology in my last couple of videos and how it's largely a failed specialty.
Imagine, it'd be like, because the thing is, Jeff's not going to know, again, like, maybe it feels petty to like harp on this, but Jeff is going to know like the basic terminology of the domain. He's not going to be able to, like, if a cardiologist were just to assume a base level knowledge of cardiology in their interlocutor, right, and try to have a conversation with him, he wouldn't know what he's even talking about, right? Yet he feels like he's in a position to basically say like cardiology is just pseudoscience. It would be like someone who, you know, didn't know like what like propositions or like entailment or modus ponens is or something like this, trying to say logic is a failed discipline. So he doesn't know what fucking electrons are, saying physics is a failed discipline. It's just comical.
Bizarre. I mean, doesn't he know the data on the improvement in heart disease since the 1970s?
I mean, doesn't he know the data? Of course he does. He doesn't know fucking anything.
But it's very perplexing. It's like, how could someone be, it's good to ask in this, you know, post-Trump era, how could someone be so confident in their stupidity? That's always my question. How could someone be so confident in their stupidity?
It's really crazy because we can only speculate. It's like a psychological question. Like maybe we need a psychologist here instead of just medical doctors. They could evaluate what the fuck's going on in that brain. But like, my best guess is he is just an ideologue. He just has certain kinds of ideological commitments, and he will jump through whatever crazy mental gymnastics are required to preserve them. That's what it looks like.
I operated on a guy today, 25-year-old with idiopathic cardiomyopathy, possibly post-infected. He's on an LVAD, so he's got a pump, you know, in his heart. Cardiologists have kept this guy alive for 5 years waiting for a heart transplant. Failed cardiology, they saved this guy. I mean, completely saved it. What's Jeff gonna do when he sees it? I mean, it's just so perplexing. It's so missing such a wide world and such a privileged view, like some privilege sitting up on this mountaintop, and his rich home, makes these comments. It's so ignorant.
Yeah, it's like it's like I don't know the word for it, but Garth, you're really like your comments are all just drawing my attention to like just how like presumptuous and like insane it is for him to be like, I don't know.
I just want to throw him into a room with a patient who's got a real problem and let him try to treat it. Here's a patient with AFib. Go for it, Jeff.
It's almost like it's almost like you're drawing attention to the fact that like he will like talk a big game about lifestyle medicine, blah blah blah. Here's how to live perfectly healthily, but like in the you know what it is? It's like in the same way that Avi knows, he would just crumble the second he's put in a debate. He would crumble the second he's put in a context where he actually has to solve some of the problems he thinks he has the answer to in real life. He's sitting across from the patient, right? Yes, it's interesting.
The other thing I'd like him to do is go to one of our scientific conferences, because if you guys haven't heard of scientific, well, obviously you have, but you go to these conferences, we eat each other up. Well, I see here that you used the student's T-squared test. Why did you use that for your statistical analysis? Really getting at each other. Criticizing the literature, and he thinks he can just Google a paper and it's therefore fact. It's just so completely ridiculous that. I just go back to this idea that we live in this like post-factual, post-intellectual time.
Yeah, I'd be astounded if Jeff even knows what distribution is.
He doesn't know that. He's never been to a study. We'll get to it when he goes to mine, where I was actually at the conference where we were, just eating the shit out of it. This is the most ridiculous paper ever, and then that's the one he brings up to put on.
Oh yeah, we I don't know if we already told you this, but we've got the archive with some of the debunks written up for the whatever data he apparently cites later in this video. So yeah, we'll get there.
Yeah, and by the way, guys, I'm gonna probably have to get out in just a few minutes. But...
Oh, then in that case, we could probably skip to where he talks about your.
Oh yeah, we need to do the part where he talks about Garth with Garth here, don't we?
Yeah. So let's do that then. Okay, so
we'll come back for the other crazy. Don't you guys worry.
Well, I don't want to take you guys off your.
No, it's worth it. All good. Don't worry about it.
All right, so let's go where he starts talking about that.
And Dr. Garth Davis, in fact, was on the board of that obesity conference that kicked out Dr. McDougall. He told me. And you can watch the video I made about this at the time. But the obesity conference, the purpose was to help educate other doctors on ways to make money treating obesity. That was the actual purpose of the conference. It was paid for by companies that sell obesity drugs and weight loss products. In 2013, the AMA designated obesity a disease. So if you watch my video, I showed the program for this obesity conference. They had lots of courses on how to build insurance companies, how to make obese patients repeat customers, how to use weight loss shakes, supplements, exercise machine, low-carb diets, bariatric surgery, etc. The conference objected to Dr. McDougall wanting to talk about 4 studies that showed a low-carb diet was harmful to heart health, thus not the ideal. Dr. McDougall has made his own video about this conference you can watch, but he was told it was a conference to teach different opinions, different options rather, that doctors could offer in their practices for obese patients, but it was not a conference to compare or criticize anyone else's approach. They didn't want Dr. McDougall comparing the plant-based diet to the keto diet because that could undermine other speakers at the conference who were pushing keto. You can watch
I don't see how any of that is relevant to myself, Dr. Davis, or Dr. Blardo.
My video on that, but my point is, doctors like Dr. Bellardo and Dr. Davis are involved in a very different kind of medicine than doctors using lifestyle medicine to get results. Dr. Avi is another kind of
Oh, my bad. I should actually.
likes to argue from
here we go.
authority, like doctors know.
Oh, here we go. So here's the claims about
conventional
Garth.
medicine doctor giving advice on social media is Dr. Garth Davis. I like Garth. He likes to argue from authority, like doctors know the research best. And I think Garth.
Okay, so claim number 1 is that you like to argue from authority and say doctors know the research best. Literally in the beginning of the video, we presumably agree that the data stands, the claim stands on the evidence that is there to support them and the validity of the arguments.
Let me say, he's not wrong about that. I do think doctors know the evidence best. I don't think I know the evidence better than he does. So he's not wrong about that. I think this idea that people are like, oh, that's an appeal to authority. Damn right, it's an appeal to authority. You know, I've been studying this all my life. I know obesity a lot better than Jeff does. He doesn't have nearly the breadth of understanding of the disease process and the physiology and the different treatment protocols and what the science says about them and how to conduct a good scientific study.
I just want to make a distinction because I don't think simply pointing out that you know better than Jeff or you know best actually is an appeal to authority. An appeal to authority is saying that my statement is true or a given proposition is true or false because of the virtue of my authority. And I don't think that's what you're saying. I think you're saying that the things I'm saying are true because of the data, and I just happen to know the data better.
Yeah, okay, sure.
Yeah, there's
So
also
that actually wouldn't be an appeal to authority.
I mean, there's this other construal that a lot of people like in appeal to authority, where it's like there's the legit and the not legit appeal to authority, and the legit one is when you're pointing to someone who actually is an authority, which, I mean, in a sense, it's still an appeal to authority, but if you just want to say, like, sort of like inductively, it's like, you know, the chances that they know what they're talking about are vastly higher if they are a medical doctor than not. It's like, yeah, I mean, that definitely raises the probability they know what they're talking about. But yeah, the core point surely is, you wouldn't say, I am right because I'm a doctor. You would say, correct me if I'm wrong, but I'm right because of the data. Doctors are likely to know more, but you're not saying that is why you're correct, right? It's not the truth.
Yeah, exactly. And I also have a breadth of knowledge with how to read a paper, what papers exist, and the specialty of pro and con to my current belief. And I get to see those papers applied in a real life situation to see whether they're worthwhile. Like, you know, it's hard to put this into terms that people can understand, but just because there's a paper doesn't mean that is therefore fact and true. Like in obesity, there was a procedure that came out called the lap band, and there were a lot of procedures showing that the lap band worked very well. And I went to the different scientific meetings, I heard the arguments, I read the papers, I said, okay, this works well. So I started putting lap bands on people. Guess what? Worked like crap. And then I started to realize where the mistakes were with the way they were putting together the papers and some of the stuff that wasn't being told. And my breadth of experience allowed me to make that assessment. Someone Googling one paper wouldn't even know the beginning of whether or not a lap band works or doesn't. So I'm privy to a body of knowledge that Jeff just isn't privy to.
So yeah, just to, I guess, to close off that point, it's like, well, I don't know everything Garth said in the past. Maybe he did appeal to authority, but the position that, as far as I can tell, you just put on the record is you're not saying you're correct in virtue of being a doctor. You're saying you're correct in virtue of the data.
Yeah, the data, the evidence, and my experience.
Right.
And probably does know best if you're considering a stomach staple or a lap band or some other kind of bariatric surgery like what he does for a living. Bariatric surgeons cut people open and reroute their intestines to help them lose weight. I believe, and I may need to be corrected on this, but I believe Garth's father was a bariatric surgeon and Garth inherited the family business, so that's what he does. And bariatric surgery...
Stop for a second. Not true. My father was a surgeon. I started the bariatric business.
Okay.
It's also interesting how Jeff seems to think he knows very precisely where the borders of your medical knowledge are. It's a bit of a presumptuous thing to say, right?
It's so ridiculous.
Okay. Another false claim, not a surprise.
According to these, it has a 70% failure rate after 10 years.
Yeah,
You won't cite this study. I tried to look for which paper this was.
It's not a paper. It never got approved for publishment. So this was we have a conference. It may be in the Sword Journal. I'm not sure if it actually ever got published. But part of our peer review is you got to present the article. So there were 2 articles presented at the conference. Again, he's not at the conference, right? He doesn't have the beginning faintest idea of how we put together these articles. So when we discuss success, we use a very arbitrary number, which we've criticized ourselves for because it is a very tough number to reach, and that is 50% excess weight loss is what we consider success. Now, keep in mind, let's say someone weighs 300 pounds and their ideal body weight is 200 pounds, so they're 100 pounds over ideal body weight. That would mean 50 pounds is our lowest marker. If you're 49 pounds, the surgery is a failure. But is 49 pounds a failure? So the best lifestyle medicine diet study ever on weight loss that showed the most weight loss ever after 1 year, keep in mind, just 1 year, was the BROAD study. And in the BROAD study, they lost an average of 25 pounds. They didn't do it right under some excess weight. I'm not sure exactly what it would be, but it would be not even close to that,
Right.
not even a fraction of that number, not even in the vicinity of 50% excess weight loss. Maybe it's 5% or 10%. Also know that just 5% of your body weight loss has huge effects on your comorbid illnesses. And so, like, our society is called the American Society of Bariatric and Metabolic Surgery. So we call it metabolic surgery because we don't really do the surgery necessarily for weight loss. It's not a cosmetic surgery. We're not doing it to help people lose weight. We're doing it because we get about an 85% remission in heart disease, in diabetes. We get about a 75% remission in reflux disease. We get about a 75% remission in sleep apnea. I mean, these numbers are just 85% remission in diabetes. I mean, that is just unheard of. And that's why we do the surgery. But again, going back to that paper, so that was a single institution study where they looked at 11 years out and saw that they had 70% what we call recidivism rate, which again was the weight dropped below 50% excess weight loss. The patient still had a considerable weight loss 11 years out. That is unfreaking believable. You don't get any other treatment that gets anything close to that kind of number. The other thing was they then presented another paper, which was a meta-analysis that looked at several different studies. Again, the N was low because previously we just didn't have long-term follow-up with patients. And we just didn't have 11-year data. We got great 5-year data, and the 5-year excess weight losses. My 5-year excess weight loss, because I've got that data, is about 78% excess weight loss. That is, so again, that person that was 300 pounds, they're now lost 78 pounds 5 years later. So that is pretty amazing data at 5 years with an 85% reduction in heart disease. But we just don't have 11-year data readily. But they did present meta-analysis. I think there was a total of meta-analysis of something like 350 patients. And the recidivism rate was 22 to 30%. So that is certainly, that means, 70 to 80% of people are keeping over 50% of their excess weight loss off. That is such a humongous success. It's mind-blowing, which goes back to, when my father had that conversation with me, and my father was pretty brash and definitely not a lifestyle. He's the kind of person that Jeff would not like. He was like, oh, it's medicine or nothing. He would say, well, you look at that data, and that data beats any kind of weight loss. When you see McDougall do a study that shows that comes even close to that, even half of that. And therefore, he would say it's malpractice to do lifestyle medicine. Obviously, I don't believe that. In fact, I look at the data and say, okay, that data is pretty good. Now, because my colleagues who do weight loss surgery really do not do good lifestyle medicine, now let's combine weight loss surgery with lifestyle medicine. And that's where you start getting the results that I see, which are just really amazing results. But the whole thing is just so offensive. I mean, Jeff never spent a day with a 500-pound patient. He has no idea how they suffer, how difficult their life is, the kind of just discrimination and this kind of talk, this kind of fat shaming that he puts against them, and doesn't understand just how hard it is in their life to lose that weight. And my life every day is just such a joy to be able to help these people out, to see such unbelievable life changes in my patients, running marathons, doing Ironman. For him to look on Google and find this, if you look up on Google failure for gastric bypass, this is the first, that picture that you have right there is the first thing that comes up. It's the first thing that he did. He Googled it, he found that, and now he's trying to speak as some kind of an expert on weight loss surgery where he doesn't have the first idea. He called it stomach stapling. It's not stomach stapling. He called it lap band. I don't do lap band. He said that I inherited the practice. He's obviously a liar. He obviously has no idea what he's talking about.
See, it's possible he's actually such an ideologue that he doesn't realize he's lying. But either way, he's definitely wrong. So I was gonna say one thing about what you said about your dad there, which is like, I mean, yeah, maybe that's too strong of a position because he ended up not being really in favor of the lifestyle medicine at all from what you put in there. But there's something I like about that though, about his approach, which was the element of like, I've got my data, you put yours on the table. Let's just see who's better. Like maybe he came to the wrong evaluation about what's better, and ultimately we should be doing both. But there's something nice about that. It's like let's just be empirical. Let's put the data on the table, see who wins. I'm confident
Well,
what
that's
I
how
am.
most
Let's throw
doctors,
down.
that's what most doctors do. I mean, most doctors say, show me the data. If you show me the data and it's good, great. If it's not, there it goes. So, I mean, that's how medicine works. We go to these conferences, we present data, we read journals, and we come to conclusions on what's evidence-based medicine.
Yeah, just like that.
But I mean, this idea that gastric bypass fails 70% is just such an unbelievable. It's just such an unbelievable misinterpretation and dangerous and sad for people that really could benefit from it.
Yeah. Let's keep
What,
going.
Garth and I actually discussed this 70% failure rate analysis, and Garth disagrees with it. He told me he knows the bariatric surgeon who presented this analysis, calculating the 70% failure rate, and that Garth disagrees with the paper. And the bariatric surgery field has other ways to gauge success, not just weight regain. And under different definitions, it can have a higher success rate. It just depends on how you define success and what parameters you choose to emphasize. But Garth also told me that he encourages his own.
But the key point here is that whatever criteria you're using to say that bariatric surgery has a 70% failure rate, if you applied that standard to anything, it would be an even worse failure rate. Imagine applying 50% excess weight loss percentage to plant-based diets or low-fat plant-based diets. It would look terrible.
Look, I've done unlike these guys, I actually keep data, right? So we have databases, and it's frustrating and sad to see how poorly lifestyle medicine